Welcome to the Heart of It, where we take you to the heart of healthcare. This season, we're exploring what happens behind the scenes at Fraser Health to ensure patients receive the best care possible. Fraser Health provides care on the traditional, ancestral, and unceded lands of the Coast Salish and Inklakatma nations and is home to 32 First Nations within the Fraser Salish region. Fraser Health is dedicated to serving all Indigenous people and honors the unique cultures of the First Nations, Métis, and Inuit living within the Fraser Salish region.
Welcome to the Heart of It, where we take the listeners to the heart of healthcare. I'm your host, Victoria Lee, and I'm excited to go behind the scenes of emergency preparedness and management today. I have Fraser Health lead Tracie Jones with me, who looks after not only emergency preparedness and management, but also BC's Biocontainment Center. Welcome to the Heart of It, Tracie.
Thank you.
When it comes to emergency preparedness and management, it seems like it's not something that people necessarily pay attention to. When we did my health survey for people that live in the Lower Mainland area, we found that only 1 in 10 people actually have anything that is around emergency preparedness, kits, information, education, that kind of thing. So how would you describe emergency preparedness, Tracie?
So emergency preparedness in my experience is really those things that you just said. It's having a plan. It's making sure that you have a kit at home and are ready to respond in any type of situation. And in those kits, it's not even about the 72 hours worth of food, but it's really the things that people need to focus on, like having a copy of their passport documents, having a little bit of spare money. In this day and age, that's a little hard to do, to allocate that, but having a little bit of spare money, having copies of the prescription, so that if they had to leave their house with just that bag of their essential information, then they have it and they can actually get assistance when they get to a reception center, that to get those documents replaced and to be able to get medications that they needed, or have a little bit of spending money to be able to buy essentials like a toothbrush and a toothpaste and those kind of things. So emergency preparedness in a personal lens is really making sure that you have those key things. I have a kit at home that does have the 72 hours worth of food, etc. Yeah. But as an organization, we have a responsibility to be able to plan for emergencies. The actual definition of an emergency is really, it's unexpected and you can't plan for everything. A friend of mine shared a quote with me from Eisenhower that said that, and it was like, it's true. So we do our best to plan for emergencies in the most fulsome way that we possibly can. For example, we have our all hazards color codes. So those are the most probably familiar to everybody, and really those are the guidelines that tell us how to respond if a patient goes missing, or if there's a bomb threat that's called in. It gives us a structure to work within to be able to do things in a crisis moment that we may not be absolutely familiar with. So we have those in place. The other things that we can do for emergency preparedness, and we have been doing, is really looking at targeted work that we're doing right now. So this is our long-term care planning for wildfires. It's our seasonal readiness that we're looking at for heat events or extreme cold. So we do a lot of work around emergency preparedness on that piece as an organization.
Yeah, thank you. You walked us through like what needs to happen at a personal level, at home, household, and then from health system perspective. And it's not something that usually like a clinical person would go into. And when I read your background, you also have a specialty in mass gathering medicine, which seems a bit of an unusual area. So can you let us know a little bit about what kind of interested you into this arena of work?
I have always had a bit of a draw to, I guess, I'm an adrenaline junkie and I love emergency medicine, and that's probably where it started. Mass gathering medicine, I work for an event medical company outside. Okay. It's my hobby that I have, where we plan disasters and prevent them from happening is our motto. So we have big mass gatherings within the province of BC all over, but really concerted into the Lower Mainland. So we have Grey Cup coming in November, and then we have Taylor Swift, which is an event.
It is.
And then
It's a global event.
It is. And then we have Invictus Games coming January, February, and then we have FIFA, yes, in 2026. But we also have these big festivals like Visaki that is a huge draw. And so the goal of mass gathering medicine really is about making sure that we have the necessary resources within the event itself to take the burden off the healthcare system.
So emergency medicine went into your hobby, and now it's become your kind of permanent work in leading and managing emergency preparedness and management here. In the past, I don't know, I guess now 7-8 years, we've had the pandemic, we had 1 in 1,000-year flooding event. No, I think actually 1 in 1,000-year heat dome, 1 in a 500-year flooding event. We've had wildfires every season, and all kinds of other things. And most recently, I think CrowdStrike emergency or crisis that occurred. But what are some of the emergencies that you think about when we're talking about all hazards kind of an approach?
So all of the things that we've basically experienced in the last, I would say decade, so flooding events, heat events, wildfires are always kind of the most familiar and most frequently occurring probably in the Lower Mainland here that would affect Fraser. I would also say that the thing that keeps propping me up at night is an earthquake for us. Yes. Organizationally, the impact is not entirely known as to the extent. There's a lot of variables with that. So to be able to plan a comprehensive plan to be able to respond in an earthquake scenario, that probably is the one that would be my next on my list for focused attention.
Maybe it'll be helpful for our listeners to kind of walk through what happens on maybe a case of or two of some of the emergencies that we've experienced. So I'm thinking with the global IMIT outage that we've recently experienced with CrowdStrike, we had, I believe, about 10,000 devices that were affected and around 500 or so servers that were affected. From my lens, I remember getting a system-wide email talking about we didn't know the full extent of the impacts, and then getting, meetings set up from midnight to 3 a.m. to 4 a.m., that kind of thing. So what happens when that kind of issue actually just occurs, and how does the emergency preparedness and management team gather, and how does the organization like ours prepare and manage those situations?
Great question. First, the emergency preparedness team, we work with our partners with HEMBC, Health Emergency Management BC, to develop plans that we could utilize, that we do utilize during downtime of any of our infrastructure and building systems, commonly known as a code gray. And so when someone is alerted to the fact that something's wrong, i.e. we got that blue screen of death and everybody's computers stopped working, there was probably the phone call started coming into the service desk, and so they were alerted to that problem. At that time, we call in our partners for HEMBC, and they help us coordinate communications and getting operational planning in place. They really help us coordinate with external parties and that as well. So generally, an EOC is struck, or an emergency operations center is struck at different levels depending on the impact and the magnitude of the event that's happening. So if it's just happening at one site, then a local EOC may be sufficient and we don't have to expand beyond that. But because CrowdStrike was not only the whole region, it was global, the impact was far-reaching, and so it really dictated a regional EOC.
So after the service desk alerts people about the code gray, people as you mentioned, different types of events require different types of emergency operations centers. So in this case, local, regional, provincial, all set up. And I think we were finding out regularly about the impacts, and they weren't uniform across the region, right?
Correct. Yeah, they weren't. In that some people's computers were affected and others weren't, and so there was still some ability to be able to utilize some of the assets at different sites to be able to work in a normal fashion. However, there were some people that were way more impacted in that they weren't able to use the computers within their unit, or so they had to find workarounds to be able to do that. So those are those downtime procedures that we use, faxing requisitions, having to go to different ways of being able to access patient charts and that. So it was impactful, and it was not level set across the region, but.
And that's the most recent example that we've had. But unfortunately, we've had many of these scenarios. And let's turn to a completely different example of when we had our 1 in a 500-year flooding event in Fraser East, mostly affected. And at one point, Chilliwack became an island of sorts. And that required a whole different set of learnings, new way of doing things and providing services and caring for our patients, clients, and also for our clinical teams and operational teams.
Yeah, it did. The flood was very interesting in that it from Abbotsford west, we seemed to be business as normal, but Chilliwack was landlocked, and then Hope was again landlocked and had a slide on one side and had to accommodate an influx of people that were stuck, because that's that confluence of all the highways that come together right at around Fraser Canyon Hospital. I would agree that we learned a lot through that event. We learned how to do things differently because it impacted our staff flow. It impacted our operational ability to move patients in a normal way. We learned how to use rail to transport people and patients. We had great collaborations with community groups that where the community of Chilliwack would opened up their ability for us to use fuel for our generators, and so the partnerships that have been forged with the East team and the communities out there has been integral in their way to actually recover from that. And long lasting, I think those relationships keep on being nurtured and fostered and developed even more, so that they really are able to lean on each other when things arise. So there was a lot of novel ways of doing the business, really, to be able to transport staff in. Yes. Helicopters, planes, trains, and automobiles, boats, and it was a 1 in a 500-year event.
And I think one of the things that we noted was also patients, like renal patients that require regular dialysis, also became like, how do we transport folks? And so I'm curious, because one of the things that we became experts at very quickly was transporting people. And what did that look like in terms of, this is when, we go into emergency operations and there's operations, there's supplies, there's all kinds of logistics and things. How did that come together as an example?
When our roadways are not available to us, then we have to think of other ways, and unfortunately, helicopters can't land everywhere. They need a certain landing zone, and they can't fly in all weather, and et cetera. So that's not always an option to us. We were able to use rail in this example. So quickly pivoting and being able to adapt to what was available to us was key. Also, with the flood event, when we had to look at different modes of transportation, that we had to connect with our interagency partners. So Ministry of Transportation, we looked at railways, we looked at different avenues that we could explore to be able to move people safely. So that all occurs within the Emergency Operations Center. And our operations teams also identified who needed to move. So as you stated, yes, we had dialysis patients that needed to be, and we had community patients that, home health patients that needed to be to be able to have appointments and that. And so what actually came out of that flood event was the creation of a couple new teams. So one in particular is a deployable dialysis team that has been created, and fantastically, they can be embedded into any area to be able to provide that service, so that if we couldn't get a patient out, it's not safe to move a patient out, we could necessarily get a team in to make sure that they still maintain that care. And making sure that we use the staff appropriately, so that if there was staff that was in that area that wouldn't necessarily work at Chilliwack Hospital, maybe they worked at Abbotsford or Surrey or Langley, we were able to credential them to be able to work at Chilliwack instead, or Fraser Canyon. There were also the ability to use alternate modes of transport to be able to bring providers in. There was also physicians that showed up that were offered to come and work because they were in the area, or they were actually just transiting through driving. And so they're like, hey, we're here, can we help?
Yeah, and you gave an example of a couple of things. One is sometimes it's wonderful when we can find lasting solutions that are from, these challenging situations, emergencies, as well as some of the heroic and wonderful things of community coming together to support an emergency like this. And I remember visiting Chilliwack, Fraser Canyon, and people that were just staying overnight to make sure that long-term care patients and residents are looked after, people that instead of, I think, coming in directly from, their vacation, didn't go home, just came directly to the hospital to make sure that there's enough staff that are able to look after patients. And I think we had an extraordinary, heroic effort of having a pediatric patient moved, and that made lots of stories. I recall it wasn't just rail, it was rail, plus I think we had a helicopter involved, and fire trucks and police, and everybody was involved in ensuring that
happened.
A pediatric patient got the care that they needed. And I think Dr. Asim Grover talks a lot about some of those examples in season 1. So if you're interested, you can learn more from Dr. Grover as well. And I guess what's become more of a usual practice is wildfires, right? So maybe you can talk a little bit about some of the recent examples, like, for instance, when we had to support patients from Yellowknife.
Right. So this was last year's fire season, and the hospital in the Northwest Territories, Stanton Hospital, had to be evacuated because the fire was very, very close to their town, and it was a decision to be made that most of the patients were transported to Alberta because that is their reference province. However, they weren't able to accommodate all of the patients. So we, within Fraser Health, Coastal, and Providence Health, we created a partnership, and we were able to receive evacuees from Stanton Hospital to an urgently set up reception center out at YVR at the airport. We were with partnership with HemBC. We were able to lease a building and stand up a reception center very quickly within 24 hours with beds, etc., and be able to receive patients off of a military plane that had been commissioned to move everybody. And be able to transport them to the reception center, be able to triage them really quickly, and make sure that they were still stable, and then be able to facilitate their transfer onto other facilities, whether it be in Vancouver Coastal or within Fraser. I think the thing that Fraser did really well in this is our regional access and flow team. They were able to allocate each one of the patients that we took here into a bed. With a most responsible, or MRP, assigned to them, so that when we phoned report from the reception center, we were able to talk to the provider. We gave them an update, and then they were received into one of our community hospitals, right into a bed, right away with a care team embedded for them. And so that was the impact of taking evacuees in was not felt by our emergency departments. I think it was the best care that we could provide at the time to be able to accommodate all their medical needs, because these weren't simple these were more complex care patients. Most of them, a lot of them elderly, with multiple medical needs, and a lot of them with mobility issues as well. So being able to facilitate them right into a bed and basically tuck them in and have somebody there to receive them and welcome them was huge.
And that's good to hear, because we had a number of years to, I guess, improve that kind of a process and what we do for those very much complex senior patients that require that attention. I'm just curious, when you were talking about evacuation, that's specific to a hospital, but what happens when a community requires evacuation? How is it communicated? What kind of partnerships occur? And how do we work with more vulnerable clients, whether they're street entrenched or working with First Nations communities, for instance?
So we've been doing a lot of work this year, very focused on long-term care at a provincial level through a subcommittee, and really how are we going to, with biggest focus on staffing and housing. So places to put people when they're evacuated, and then how do we care for them over the duration that we need to provide that care. So we've done a really big focused effort on that, and supplies, and being able to have that sustainability. So those are our most vulnerable, and not always our easiest to move, right? Because our frail elderly that are in homes, and that they may have complex dementia or complex medical problems. So it doesn't make it always as easy to be able to just move them. And do it in a way that is safe for them and it's long, to be put on bus or on a plane and that. So we've been doing a lot of work around that. But when a community is affected, i.e. like when Hope was affected by the Kupiki fire last year, being able to stand up a mass care site, to be able to have a reception center that we can connect with everybody, make sure that everybody is identified and receiving the care that they need, whether it be healthcare or whether it be emergency social services as well, right? Accommodations. We have in the last year established a partnership with Fraser Health's Indigenous Health, Emergency Preparedness, Métis Nation BC, and FNHA.
First Nations Health Authority.
Right. And we meet on a monthly basis to talk about emergency preparedness and planning, and specifically about notifying. How do we notify each other, understanding what each of our roles are in emergency preparedness, and also how can we support each other to make sure that if we have knowledge within the health authority of an emergency that's coming, how do we notify our communities? But also, if something is happening in a community, how did they contact us for help? So it's a really important relationship that we've built over this last year, and it's growing, and it's just starting to roll into this really great project together.
Great. You mentioned the social worker and that type of support that's available. Of course, some of these events can have long-lasting trauma and pain and also emotional mental health concerns that arise from it. How do people actually get support as they work through some of those?
So for community members, they're usually, if it's an event of magnitude, there's an emergency social services team that is deployed, and they are there to provide those services, or to give them referrals, information. But for staff, we're making sure that our responders are also taken care of, is making sure that they have employee health and wellness information. So what are our supports that we provide for our staff? Is there critical incident stress? Accessing all the resources that are available to us through Fraser Health is key, but really actually just checking in and talking to people and having the moments to be able to just allow people to take a break. and take a step away for a moment and collect their thoughts and take a deep breath. It's really important that we communicate as a team. But for community members, there's lots of resources out there. It's making sure that we get the information out to people in a timely way through social media channels. Fraser Health does a really good job at being able to blast out information in emergent ways and also preventative ways at the beginning of seasons. We tend to have our communications decks that go out, and those are great because they provide a lot of that information.
Well, we talked about you being an adrenaline junkie, and we're very fortunate that you have this hobby of mass gathering medicine and now are managing our emergency preparedness and biocontainment center. Anything about Biocontainment Center that you want to share?
So Biocontainment is a little known little center that we have located at Surrey Hospital, and this is a really highly trained team of critical care and emergency trained nurses and respiratory therapists, both adult and pediatric. We have a contingent of physicians, both adult and pediatric intensivists, that are part of our team. And our focus and our goal is to be able to provide high-level critical care to somebody who may have been identified as being diagnosed with a high-threat pathogen. And a high-threat pathogen, really, if for ease of description, is anything that is of consequence or for example, Crimean Congo hemorrhagic fever or Ebola or Lassa fever. So a lot of the viral hemorrhagic fevers would be a patient that would necessarily require biocontainment because the consequences of that disease getting out and spreading is high. The likelihood of having a patient that has that is low, but the consequences of it are high. So the team is trained in high-level PPE, being able to provide critical care in high-level PPE.
It's an impressive space. I remember walking through it before and during and then after Ebola scare as well that we had in the region. Well, I'm curious if there's a story that, I mean, you've shared many stories, but is there a patient story that especially touched your heart that you would like to share?
I have been a nurse in Fraser for 30 years. And so there's been many. I think the one that probably impacted me the most in my professional career was the story of my dad. And it was before I was in nursing school because I really wasn't going to be a nurse. I was going to work in the hotel and travel industry. My father got sick. And he subsequently passed away very quickly. But it was the nurses that took care of him at St. Paul's Hospital in the palliative care unit that put me on this path.
Really?
Yeah. Absolutely. As a 19-year-old kid, you don't expect to be making a pivotal decision at that point. But yeah, it was my dad.
And end of life especially, and I think, as a nurse, it's an everyday thing that you're looking after others, but for those that are others, it's a once in a lifetime, and it, as you said, it can make such a big difference. Yeah. And end of life is also a special time for an impactful time. One word for future of healthcare?
Evolving. And I choose that word because we need to learn from our past. We need to adapt in the present, and we need to be innovative in our future.
Oh, what a beautiful way to sum up even what we've been experiencing in emergency preparedness and management as well. We've learned and adapted from what the lessons learned from all of the events that we've had, from climate to pandemic to even the toxic drug crisis. And we're adapting constantly in the way we are actually managing these areas and trying to be quite innovative in how we manage them as we go forward.
Yes.
So thank you for sharing, and thank you for being here today.
Thank you.
Join us next time as we continue to get to the heart of healthcare. Don't forget to rate and subscribe to this podcast. The Heart of It is produced by Fraser Health Communications and Public Affairs.